So it's 7 o'clock and we're going to get started with our virtual Zoom webinar or informational for healthcare professionals. I want to welcome all of our business partners, all of our newest business partners. Tammy, welcome, welcome. So excited to have you join us. And tonight we're going to get started with our, let's see here, see if I can share my screen. We're going to get started with our presentation. So I'm Dr. Rita McGuire. I'm the Chief Medical Officer of Wakana. I am also one of the co-founders here. But tonight we're going to get to learn really more about cannabis and its medicinal properties and how healthcare professionals can introduce this to their patients and clients. I'm also a 30-year obstetrician gynecologist, can't even believe it. I attended Wayne State School of Medicine in Detroit, Michigan. I completed my residency right here in Chicago at Cook County. I'm also CEO of RJM Wellness and Ripped Rita Fitness. I'm a global speaker for women's health and fitness. I'm also one of the certifying physicians for the medical marijuana program here in Illinois, along with the opioid exchange program. I'm a member of the Doctor for Cannabis Regulation, and again, Chief Medical Officer and co-founder for Wakana for Life. So I want to welcome all of you to our presentation. And, you know, Dr. Joy Smith is going to chime in here after me, but as healthcare professionals, you know, be it a physician, a pharmacist, a chiropractor, dentist, nurse practitioner, a massage therapist, a clinical psychologist, a psychiatrist, family medicine, you name it. As a healthcare professional, I think it's imperative that we understand cannabis and how it's used medicinally, because CBD is truly all the rage among our patients. Patients are looking to us to really help navigate their way through different products and companies as it relates to their health and wellness. So we know that many of our patients are on multiple medications. In fact, it is stated that the average 50-year-old is on 67 pharmaceutical medications and the average 70-year-old is on 10 to 12 medications. And we understand as healthcare professionals that medications, yes, are needed. Medications have their role, but we also know that patients are looking for alternatives. They are looking for natural alternatives. They're looking towards botanicals that can, one, help alleviate a lot of the challenges that compromise their quality of life, but also the side effects. You know, when you're on multiple medications, many of our patients are prone to many, many side effects. So why do physicians have a thumbs down when it comes to cannabis or any of the constituents that the cannabis plant affords us? Well, it's because we're not taught about cannabis in medical school or dental school or pharmacy school or any of the disciplines that the healthcare industry is involved in. We're just not taught about its medicinal properties. But what you should understand is when a patient is looking for CBD, it's important to understand where it is sourced from, because CBD can be sourced from two different species of the cannabis plant. It can be sourced from marijuana, and many patients don't want CBD that's sourced from marijuana. Why? Because it will make them high. You know, marijuana has a high level of a compound called THC. Many of us have heard of THC, or delta-9 tetrahydrocannabinol. This constituent that's very high levels in marijuana will get your patients high. But when we talk about CBD sourced from the hemp plant, from the hemp species, this is an opportunity for patients to get that health that they're looking for without the high. So hemp contains large levels of CBD, and trace amounts of THC. By definition, 0.3% or less of THC is where hemp is sourced from. So when we look at the cannabis plant, you know, many CBD products are sourced from the cannabis sativa. The cannabis sativa species is the one that's very tall. In fact, it grows between 6 to 12 feet. It has very thin leaves, and sativa is the part of the plant that has more energy, creativity. It helps with so many things, but it is more of the energetic, what we call species. And then there's the indica. The indica is a very short plant. It grows to about 3 to 6 feet. The leaves are very thick. And when we speak of indica, we're thinking more of a plant source that gives us more the ability to relax. They call in the couch, right? And then ruderalis. Ruderalis is even smaller. This plant gets around 2 feet high. The leaves are more on the thicker side. And ruderalis, this species is not commonly sourced for products. It's used mostly for textiles and fabrics and things like that. And then there's different parts of the plant, the seed, the leaf, and the stem of the cannabis plant that has not only nutritional values like nutrients high in fat, fiber, proteins, amino acids, and other botanicals like essential oils, but the compounds or the phytocannabinoids that are sourced in the different areas of the anatomy of the plant is very crucial. And that's why when we speak about a whole plant product or a full spectrum product, we have not only the constituents of CBD or cannabidiol and THC, but many other cannabinoids that the plant provides, like CBG and CBN. There's over 113 compounds that the cannabis has now been able to identify that it produces. Some other reasons why physicians have a thumbs down, why healthcare professionals in general have a thumbs down towards cannabis is one, because we weren't taught anything in school. We're not knowledgeable, but we also have issues. Will this interact with the medications that our patients are already on? So it's really important that as healthcare professionals, we understand that there may be a negative interaction with other drugs when we speak about CBD. So we need to know how CBD is metabolized, how it works in the body, because CBD can have an inhibition or an antagonistic interaction with medication. So some of our patients that may be taking, for instance, metformin for their diabetes may potentially have a reduction in the effectiveness of that drug. I'm using metformin as an example. Or other drugs that could interact with CBD could have an agnostic or agonistic interaction, or it can potentiate the effects of that medication. So it can be too strong. One can be antagonistic, it can be not as effective, or it can be a potentiator when we talk about CBD and its interactions with other drugs. So it's important to know, and we're going to talk more about how the body metabolizes CBD, and it's metabolized in the CYP450 liver metabolism. If it's metabolized by the liver, all drugs, many drugs are metabolized by the liver. So we'll talk about what that means and how to really talk to your patients about drug-drug interactions. Another question and another concern as healthcare providers is, will CBD show up in my patient's drug test? And what we know is that there are companies out here that are marketing their products like it comes from the hemp species, but it's really coming many times from the marijuana species. Again, that can interact and cause someone's drug screen not to be favorable or in their favor. There's other products that can assure that your patients pass their drug screen. Those are called broad spectrum products. Those are products that have less than the 0.3% of THC in that product so that your patient can use that as well. Making sure that you seek out a reputable company, a company that not only is sourcing from hemp, but sourcing organic hemp, making sure that the quality and the potency is accurate, making sure these companies are doing third-party validation, ensuring that the product is safe and effective. So a product that's full spectrum that may contain 0.3% of less of THC may cause a drug screen not to be passed. A product that even has 0.2 may fail. So again, knowing which products for our patients to safely use so they can pass a drug screen. So who really, truly brought cannabis back mainstream? And really it is Dr. Sanjay Gupta, who came out in 2013 and 2014 and said that what he spoke about in 2009, which was no to weed, no to pot, no to cannabis. Well, he said in 2013, 2014, he made a public apology that this plant has been identified to be absolutely an option for health and wellness and overall improvement in quality of life in thousands of people. He was able to travel the world. He was able to look at all of the documented research and data that you can find right now in the scientists in Israel. Lots and lots of studies are known to be effective usage of cannabis in the Israeli or Israel, in the country of Israel, as well as in 2018, what happened was the Farm Bill was passed. And the Farm Bill, sorry, I hit something, sorry about that. The Farm Bill in 2018 was passed, which allows hemp to be cultivated, hemp to be sold and consumed in all 50 states. At the same time, the FDA did approve a prescription, a CBD prescription. It's called Epidiolex. It's manufactured by GW Pharmaceuticals, and it is a synthetic CBD product that's used for children. Children who have Lennox-Gastaut syndrome, for your pediatrician on the line, Dravet syndrome, or even tuberous sclerosis. So there is a lot of knowledge that the FDA understands that this plant can be an option for patients. So let's look again at hemp. Hemp is nutritional. Hemp has been used for centuries. In fact, the very first automobile, the Model T, was sourced from hemp. The very first Bible was produced from hemp paper. So hemp not only is nutritious, it can be used for textiles and fiber and cars, but it can be used as an alternative for those who are looking for a natural and holistic way of addressing their health. So we spoke about how the cannabis plant, the hemp species, can produce over 130 cannabinoids, but still the hero, the main cannabinoid that the hemp plant makes is CBD. And as you can see here, CBD has a long list of medicinal properties, you know, from CBD being an antibacterial to helping to reduce inflammation, to help reduce pain, to help reduce anxiety and depression. It's a vasorelaxant, so it's been very instrumental in assisting in those who have high blood pressure or diabetes. The list goes on and on and on. But there's other cannabinoids like CBG and CBC and CBN and delta-8 THC. All of these cannabinoids and many more that are not even listed here synergizes on a cellular level and can really promote a better quality of life in those who may be seeking an alternative for insomnia, or those who may be seeking an alternative for their arthritis, or those who may even be seeking an alternative for their overall mood stabilization. So many peer review articles have been reviewed, over 20,000 as it relates to CBD. But then, more importantly, as a healthcare professional, you need to understand how CBD works in our body. It is a science behind how it works. So many patients want to hear that you understand how it works, and it works through the human endocannabinoid system. This is a system that was discovered in the early 1990s. Data way back into the 1940s, when in 1960s, when THC was first discovered, an Israeli scientist was really working on how does it work in the body. And decades later, this science was proven to show that the endocannabinoid system is important to keep our body in balance. So when we consume CBD, when our patients consume CBD, these receptors that are found throughout not only our brain, our central nervous system, our immune system, and our periphery, but they're found in every organ and gland. And when those receptors are bound with the CBD or other cannabinoids in our body, it puts our body back in balance. It reduces inflammation by working on pathways that are inflammatory. It works on pathways in our brain that regulate and modulate the sleep-wake cycle. It works on pathways in the body, in the immune system, to help reduce the activity in those autoimmune patients that we may have, like lupus and fibromyalgia. So the science is there. There are receptors, CB1, CB2 receptors, again, found throughout our entire body. But what's also important to know is that our body produces cannabinoids just like the plant. And endogenously, our body is able to produce anandamide and 2-AG. And again, these are two very important cannabinoids that are endogenously made by our body to keep us in balance. And the reason why our patients are looking to take CBD is because these endogenous cannabinoids become deficient. They become deficient because of the food our patients are eating, their diet, their stress level, their inability to sleep well. These cannabinoids are not functioning at their most optimum level. And so we all need to consume CBD to keep our body in balance. Now, there are different methods of consuming CBD. You know, patients may ask you about this. There's capsules, there's edibles, there's an oral applicator or tinctures that you place underneath your tongue. There's liquids that you can infuse in beverages and food. There are vape cartridges, and there are topicals. So all different ways to consume. Of course, each different method takes a different amount of time for their action to be evident in the body, and the duration as well. So when we look at the signaling, when we look at these receptors, the endocannabinoid system works in a retrograde fashion. It's not what we're used to thinking when a neurotransmitter stimulates in our body in other systems, but the endocannabinoid system works in a retrograde fashion. And why this is important to understand is this is what helps us to understand why CBD is so effective in hyperactive disorders like seizures, epilepsy, ADHD, a lot of these disorders like anxiety. So the neurotransmitter, once CBD is consumed, binds with the receptors on the postsynaptic neuron, which is the receiving neuron, and sends a signal retrograde or backwards or upstream to the presynaptic neuron, which then sends a signal to the different parts of the body. But again, this retrograde activity explains why CBD has been so effective in your hyperactive situations, your seizures and epileptic situations, because it is a retrograde transmission. Again, these are different parts of the brain, the central nervous system, and other areas where these receptors are found. When we speak about the brain, when we speak about our mood and movement, again, these receptors being bound with CBD can allow patients who have movement disorders like Parkinson's, who have mood disorders like depression and anxiety, have relief. Again, this is another diagram of where we see the cannabinoid binding to different neurons, sending a retrograde signal either to the brain or central nervous system, or we have over here the immune system to cause improvement of quality of life and overall wellness. Now, where do you find a lot of these studies? Because as healthcare professionals, we want to see the studies, right? PubMed is a really good source. That's a source that I use a lot. In fact, I get at least 20 or 30 emails a day from folks asking about studies. And someone today asked me about CBD and its effect on irritable bowel syndrome. This is a study that shows how CBD and other cannabinoids that are non-psychoactive, and that's important because our patients don't want that high that they would get from a medical marijuana product, but they want that overall benefit of CBD and other non-psychoactive cannabinoids in the treatment of GI disorders like IBS, irritable bowel syndrome. Also, there's studies on cancer treatment, meaning that CBD has been studied in those who are undergoing chemotherapy and even radiation, helping to reduce nausea and vomiting, just helping with those overall symptoms that we see when our patients are getting cancer treatment. Anxiety disorder, again, this study shows how CBD was a potent or a potential treatment in those who have anxiety. So this experiment was testing those who were using smokable products. We know those work very fast within 1 to 5 minutes. Difficult to treat pain, our patients who have sciatica, neuropathy, those really difficult to treat pain, studies showing how CBD can also assist with that. So that is hopefully some information that you can use, that you can get started in really having an open conversation now with your patients. We're going to move on to Dr. Joy Smith, who is a PharmD. She's one of the lead pharmacists here in Chicago at Stroger Hospital. I'm going to hand it over to you, Dr. Joy.
All right, Dr. Rita, and before I go on, this person really wanted to tell you hello.
Oh, how are you, Ayana? So good to see you.
I learned a lot from you today.
Oh, thank you. Thank you so much. Okay. I am so excited to see you.
Say bye-bye.
Bye.
All right. Hello, everyone. That's Dr. Rita's patient. She is convinced that Dr. Rita is her eye doctor, so we just go with it. But let me pull my slides up here. Just give me one moment. Ayana had to make sure.
When she finds out that I'm an OB-GYN and what that means, she's going to laugh.
Oh my goodness, she is going to love it. She's probably going to want to be just like you. She loves babies. Okay, here we are. So let's go ahead and share. As Dr. Rita stated, I am Dr. Joy Smith. I'm a pharmacist at the Cook County Hospital, or John H. Stroger Hospital, where she actually did her residency. So I feel like everybody in Chicago who's a part of healthcare was at Cook County at some point or another. I've been licensed for about 8 years, working in outpatient, inpatient, worked in retail, different ambulatory settings such as the anticoagulation clinics. And I've had a number of certifications outside of my pharmacy license. I'm an integrative nutrition health coach and aromatherapist. And I also am a member of the International Society of Cannabis Pharmacists, which was sparked by my inclusion in Wakana. I wanted to learn as much as I could, as fast as I could. And by joining those professional organizations who speak the same language, who are healthcare professionals who are excited about learning how this plant can really impact the lives of their patients, I was happy to be a part. I am also a Ruby dispensary owner at Wakana, and I really believe in our mission, our vision to get as much information health-wise about CBD out as possible. So Dr. Rita talked a lot about this, but we're just gonna kind of reiterate a couple of things about why people seek CBD. The studies that she brought up, the information that she shared really pointed to anxiety, pain, depression, and there are a few stats around those three topics that really drive that point home. So let me minimize so you can see. Chronic pain is the #1 cause of disability and disease burden globally. When you're looking at anxiety disorders, you're looking at about 40 million adults ages 18 and over. And 6.7% of American adults have had at least one major depressive episode in a given year. And when we're talking about this past year, now that we're coming up on 1 year of being in this COVID-19 pandemic, being quarantined, we're talking about how the prevalence of depression symptoms in the US before versus during the COVID-19 pandemic. And this quote is really important to me because it really speaks to the types of patients that I encounter on a daily basis. Prevalence of depression symptoms in the US was more than 3-fold higher during the COVID-19 pandemic, compared with before. And that depression is affecting people with lower social resources, lower economic resources, greater exposure to stressors. Those people are having the greatest burden. And I say that applies to the patients that I work with because at the county hospital, we treat patients regardless of ability to pay. So whether you have great insurance or whether you have no insurance. And a lot of our patients have low health literacy. A lot of our patients have low medication literacy when it comes to why they should be taking their medication. So it's really impacting the patients that I see on a daily basis. So when we're talking about taking medications, when we're talking about depression, we're talking about all of these different things that are plaguing our communities, we also bring CBD into the picture because we know that CBD has amazing effects on depression, on anxiety, and you may want to know for your patients' purposes, are there drug-drug interactions between CBD and prescription medications? And the answer is, very honestly, yes, there are interactions. But what's going to be important for us to understand is that there are ways to circumvent those interactions so that they're not causing a problem in the patient. So if we go back to school and we go back to thinking about metabolism of drugs, we're talking about our CYP450 enzymes. These 6 enzymes are responsible for about 90% of the metabolism of 90% of the drugs that we're probably prescribing to our patients, or in my case, that I'm counseling my patients on. So when you look at CBD metabolism, remembering that CBD is a substrate of 2C19 and 3A4. Those are the enzymes that are designed to break down CBD. Now, CBD is going to inhibit any drug that goes down the pathway of 2C9, 2D6, and 3A4. Now, that could be an issue if you take the CBD and the medication together. But what we all need to understand is that we don't need to avoid CBD. We don't need to avoid botanicals. We don't need to avoid natural methods of healing just because we don't know how to use them yet. I was working in the anticoagulation clinic before Wakana found me, and patients would ask me, can I take CBD with my warfarin? Can I take CBD with any other drug that I'm on? And I honestly couldn't tell them. I would say, go talk to your doctor. But now that I've been armed and equipped with the understanding of how CBD works, how impactful it is in the system, and how it's not just another type of weed. It's not just something that's gonna cause harm to our patients. I'm excited and I'm empowered to begin to educate them about how they can take them alongside their medications. So these medications are from categories of disease states that a lot of the patients that I see have. And I see a lot of patients in outpatients. So you're talking about high cholesterol, asthma and allergies, diabetes, hypertension. I mentioned I worked in an anticoagulation clinic for about 5 years. So anticoagulants, all of these different things, pain medications. These medications have the potential to interact with CBD, but what do we know? We can space these medications out about 2 to 4 hours from the time that we take the CBD or that our patients take the CBD, and then we can avoid those interactions, making sure that they don't travel down the same metabolic pathways as the CBD at the same time. So as healthcare professionals, ones that have studied traditional medicine, have been taught that drugs are first line, all of these different types of things, who's using alternative medicine? Why should we care about this? And I found that this chart was very important in showing the treatment trends in terms of alternative medicine and how people are seeking out different options for their healing and for their wellness. So going from 2014 to 2025, you're seeing an increase in the blue bars at the bottom. Those blue bars represent botanicals, and CBD falls into botanicals, essential oils fall into botanicals. Those are just medicinal compounds, as we know, or they're plant-based compounds, as we know, that have medicinal benefit. So we're looking and seeing that that botanical use is increasing as we go on, and it's going to continue to increase as people continue to gain interest, as it gains popularity among our patients. And we want to make sure that we're completely educated on how those botanicals work. So speaking of botanicals, I mentioned that I am also a certified aromatherapist, and I am fascinated with how plants can help to address a lot of the issues that we're having, from pain to stress to mood to other different issues, how it can just kind of get in our cells and our systems and remodulate what's going on. But specifically essential oils, they are highly concentrated aromatic extracts that are distilled or expressed from a variety of plant materials. So you're talking about the roots, the seeds, the flowers, the grasses. These are the places that the essential oils can be extracted from. And I always like to show this picture. I talk about it on our certification anytime I'm doing any essential oil presentations, because I think it's really powerful. This is a picture of a doctor back in the times when the bubonic plague was going on. And for those of you who don't know about the bubonic plague, it was extremely contagious. Anybody that got into the area where the bubonic plague was, they were contracting that plague and they were dying. And so the doctors dressed up in these cloaks, and not only did they have on these cloaks and these masks that looked like bird beaks, but on those cloaks and inside of that mask was an essential oil blend that was used in some areas. And that essential oil blend contained cinnamon, clove, rosemary, eucalyptus, and lemon. That blend is an amazing blend that makes viruses very uncomfortable, makes it hard for viruses to live in their presence. And that just speaks to the power of essential oils. Essential oils are not new. Essential oils have been used for thousands and thousands of years, and they truly do have medicinal benefit that is just now being uncovered. Some people have studied it for years, but a lot of people don't know. A lot of people didn't know about CBD and know about the medicinal benefit of cannabis. A lot of people didn't know about essential oils and are just now coming into that space. So I just always like to highlight that this is not a new science. This is an old, tried and true science. Now, when we're talking about how we inhale essential oils, what happens when we inhale essential oils? Those essential oils travel through the olfactory neurons, through the olfactory bulb into the nasal cavity, and ultimately reach an area of the brain that we know of as the limbic system, that controls emotion, that controls memory, that controls mood, those types of things. And so when those essential oil molecules get into that area, they can spark a memory. For instance, if you're smelling something and you remember a dinner that your grandmother used to cook, or brings to remembrance a dinner that your grandmother used to cook, or a perfume that your significant other, or a cologne that your significant other used to wear. Your brain works together to send those signals out to your body to invoke that memory, and also send signals out to your body to relax you, to energize you, different types of things. And that's just what happens when we inhale the essential oil. Essential oils can be used topically as well. Some essential oils can be used internally, but you do want to make sure that you consult with an aromatherapist like myself, who has the resources to be able to track whether you can consume essential oils based on the fact that you're pregnant, or if you have different medical conditions, or based on what medications that you're taking. So it's just amazing how essential oils are able to work both, well, topically, aromatically when you're putting it into a diffuser. When you inhale it, whether it's just through the bottle or rubbing the molecules together in your hands, really activating them and getting those into your system. Just amazing, amazing ways of using this essential oil science. And the Asian Pacific Journal of Tropical Biomedicine says this. I talked about the remodulation inside of your body, but once the essential oils are in your system, they remodulate themselves, go to the site that they're needed, go to the site of malfunction. They know exactly where to go, and they know exactly what to do to impact change in the body. And then you'll get relief from numerous ailments, depending on which essential oil is used, depending on how much is used, from things like depression, indigestion, headache, insomnia, and much, much more. And it's found that essential oils and CBD for that matter are found to be more beneficial when you're considering other aspects of life, where you're considering having a healthy diet, where you're considering having a healthy lifestyle, where you're considering bringing yourself to a place of calm. Your body reacts to the things that it interacts with. And so if you're interacting with a poor diet, if you're interacting with stressful situations, it may be a little bit harder for those essential oils to get into your body and remodulate. But when you consider all aspects of life, similar to how you consider health and wellness being for the total being, not just for the arm, not just for the head, not just for the neck, but for the total being, it's a group effort with you, your body, and the things that you expose your body to. So now this chart is one that I like because it gives you information about the chemical constituents of essential oils. So you'll see the chemical constituents and how they're used or what they can do on the left-hand side. And then on the right-hand side, you'll see the essential oils that fall into that category. So for instance, let's talk about, the esters, right? The esters, they have antispasmodic properties. They can, they're equilibrating, meaning they can bring you back to equilibrium, antifungal. So when you're looking at different oils that correspond with that, the esters are here. So the oils that correspond with that are over here, whether you're talking about lavender or ylang ylang or clary sage or geranium. These are just examples. If you go down to the sesquiterpene alcohols, you may encounter ginger, vetiver, frankincense. These are examples of how the left will show you exactly what the essential oils can do, how they can impact change in the body. And the right will show you exactly which essential oils do that. So it's amazing how our essential oils, how our CBD can sometimes have some of the same impact as some of the prescription drugs that we may be prescribing to our patients. Am I telling you as a healthcare professional to another to just take your patient off of all their medications and just start new with essential oils? Absolutely not. I think everybody has an individualized treatment plan. Every doctor knows their patient and knows how they need to proceed. But what I am saying is there are plant-based alternatives out here that can provide symptomatic relief with reduced, if any, side effects. So I'm just excited to be able to have this alternative for patients. I am excited that I chose to open my mind to what essential oils, CBD, and other botanicals can offer. And I'm excited that I have this knowledge to give to not only my patients, but to my family, to my colleagues, and other healthcare professionals like you all on the line. So what I want to give you is some essential oil safety considerations, and some of these go for CBD as well as essential oils. Don't apply to open wounds. If you're looking to apply an essential oil topically, for instance, because of a pain or pain around an injection site or pain around a wound, let that wound heal up, let it scab up, and even then still apply it around the wound. Keep away from the eyes and wash your hands after use. So when we get anything in our eyes, when our patients get anything in our eyes, or even at the hospital, there's always an eye wash station with water, right? But when you're getting an oil inside your eye, oil and water don't mix. So there's nothing that's going to be able to pull that out of your eye. So when you do get oil inside of the eye, make sure that there's a carrier oil nearby that can be applied, whether it's olive oil, coconut oil, another oil that can pull that oil out of the eye area. When patients are using essential oils or even topical CBD for that matter, patch test a small inconspicuous area, whether it's your arm, the back of your leg, maybe if you have long hair, the back of your neck. Whatever is not going to be seen, so you can ensure that if there is a reaction, that it's not something that's so prominent. Your patients should be reading the warnings, but us as healthcare professionals should really do the research. There are tons of peer-reviewed articles out here on CBD, on cannabis. There are peer-reviewed articles out here about essential oils and their benefits and their uses. So we should educate ourselves on the studies, as well as how they may interact with our pregnant patients, patients who have serious medical conditions, are on other medications, what have you. We should be equipped as well as our patients should be equipped. Again, I stressed about the 2 to 3 hour, and let's even say 2 to 4 hour space between medications and essential oils, or medications and CBD, because it's important to know that we don't want them traveling down the same metabolic pathways at the same time. More is not better. So these essential oils are very volatile compounds that are very powerful. CBD is very concentrated, very powerful. More is not better. You don't need more to make as much of a change as you would think. And if you're diffusing an essential oil, diffuse it for up to 30 minutes at a time. Make sure that you're not overwhelming the senses. If you must leave the diffuser on, see if you can walk out of the room after about 30 minutes. But we just won't want to overwhelm the senses. And the last thing that I did not include is make sure that your CBD and your essential oils come from reputable companies. There are so many companies out here that put fillers in their products, that put toxins in their products, things that are going to be hormone disruptors in their products. And you want to make sure that whatever company you get your essential oils from or your CBD from, have certificates of analysis, have transparency in their procedures and in their processes, so that you know that whatever you're getting is not going to be of detriment to you or your family members. And you'll be able to hear a little bit more about that at 8 o'clock when we talk about Wakana and how Wakana is able to provide those quality products to our consumers. So Dr. Rita, I will give it back to you.
Thank you so much. Thank you for all that great information. And we have just a couple of minutes, Dr. Joy, and we can take a question or two. It's only 7:40. We have 20 minutes before our 8 o'clock business overview. If you're a guest on the line, please connect with the person that invited you so that you can hear more about our products, our company, and why you should absolutely choose Wakana products when you're talking to your patients, when you're talking to your clients about CBD and essential oils. So is there a question?
I see one. I'm reading through it now. It's from Diana Coleman. Oh, thank you, Julie. Beginning stages of glaucoma. So Dr. Rita, my preliminary answer to this question, both would be the same prescription. My preliminary answer to this question, I remember you talking about how there's been studies of there shouldn't be CBD use over a certain amount when you have glaucoma because of the intraocular pressure that can occur.
Right. The studies out of the Mayo Clinic stated that no more than 40 milligrams of CBD a day in those who have glaucoma. Over 40 milligrams can actually potentially increase the pressure in the eye. And you want to do the opposite. You want to reduce the inflammation around the optic nerve, and you want to reduce the pressure. So no more than 40 milligrams of CBD on a daily dose when we talk about those who are looking to use CBD to assist with their glaucoma. You know, we can't make or use terms like cure, treat. What we can do is, again, use this platform on Tuesdays at 7 o'clock to show healthcare professionals, and if you're a lay person on the call, the science. And that's what the science shows, is that no more than 40 milligrams of CBD a day when you're talking about assisting those who have glaucoma. We cannot say at all that it's going to cure your glaucoma or reverse the pressure, but that is what the studies have recommended as it relates to glaucoma.
I think that was all. We didn't have any more.
It's something about sinuses.
Oh, I just didn't see that.
Yeah, so unfortunately, Diana, we're not here to make diagnosis. We can't diagnose you. We can't say if it could be your sinuses. You would have to absolutely seek medical attention from your physician to see exactly what you're dealing with. Are you dealing with additional pressure from sinuses, or is it just the glaucoma? So hopefully that helps you.
Mm-hmm.
Unfortunately, we can't get into diagnosing anyone medically and as it relates to their condition. Anything else? I don't think there's any questions in the Q&A. Well, you know, this platform is happening every Tuesday at 7 o'clock. We really want to encourage all of you, if you are on the line and you are business partners with Wakana, that you invite your healthcare professional. You invite anyone that you know in your family and your friends and your circle that are healthcare professionals on the line at 7 o'clock. And they can be anything. They can be dentists, chiropractors, pharmacists, nurses, nurse practitioners, clinical psychologists, social workers. They're in the healthcare profession and they are in front of patients. We want them on the line.
I think that's all we got, Dr. Rita.
Okay, that's it. Wonderful. Well, we will see you in 15 minutes, our overview. Again, if you're on the line and you want more specific information about our products, our company, then 8 o'clock is the call for you. Otherwise, thank you, Dr. Joy. I will see you then.
Yes, ma'am. See you later. Good night, everyone.
Good night, everyone.